Deaf and/or Hard of Hearing by Ashley Headrick. Around 48 Americans, or 20%, have some sort of hearing loss categorized into 4 degrees: mild, moderate, severe, or profound. When looking at a population of 6 to 9-year-old school-age children, we see that close to 15% have hearing loss to some degree. Hearing loss is the third most common physical condition following arthritis and heart disease. Hearing impairments are the result of problems or damage to one or more parts of the ear at birth. Hearing loss, however, happens after birth, meaning that an individual was able to hear at one point in their life. While both of these can lead to deafness in some cases, individuals tend to still be able to hear a little. It's just difficult. With deafness, little to no sound is heard, but vibrations. 80% of hearing loss in teens is due to loud noises, as it can lead to a condition known as noise-induced hearing loss. Things like headphones, loud car speakers, and video games can make an environment too noisy for some people, leading to a rise in teen hearing loss not seen in some 30 years. It is important to be aware of the damage that things like this can cause, as well as the lifelong impacts. With hearing impairments and deafness, early identification is a big piece, as early auditory experiences impact a child's ability to develop necessary literacy skills. This makes sense given the fact that most children begin to attach meaning to text when being read to at 1 to 1.5 years of age. Due to this, universal newborn hearing screenings have become a hot commodity before bringing a baby home. Even with these new advancements, there has been little growth in student literacy outcomes. Students still show to be around 13 months behind peers when it came to vocabulary, and there was barely any growth when it came to phonological awareness and reading. While early identification is helpful and allows for instructors and parents to be aware of the issue, many need targeted support in their early years to allow them to achieve grade-level literacy skills. Focus needs to be put on English vocabulary base, spoken English language, as there are delays in the English words, and most important area of phonological skills. It is important to recognize all the areas that can be impacted by a hearing impairment and/or deafness. A student may have difficulty conversating with peers, interpreting oral directions, and/or fitting in. We must do our best to not only focus on a child's academics so far, but also the student's social and behavioral skills, as well as communication. Foundations of Literacy is a multi-sensory integrated program that helps meet the needs of hearing, language, and literacy abilities that a child is expected to meet. Studies found that students with DHH, deaf and/or hard of hearing, struggled with literacy development as instruction tended to move too quickly for them, contained poor phonological representations, had unknown vocabulary, and there was a lack of visual supports. The Foundations of Literacy program was designed to meet these needs. Children are taught letter-to-sound correspondences using sound stories and hands-on activities with an abundance of appropriate literature. Many visual supports such as visual phonics, pre-teaching, and scaffolding are used to teach the topics. The program provides leveled lessons and materials that teach alphabetical and phonological awareness, vocabulary and language learning, and emergent literacy skills. It is designed to be implemented for 1 hour 4 times a week for the duration of the school year with kindergarten and pre-K students, or children ages 3 to 6. It was designed using over 10 years of grants given by the Institution of Education Science and the U.S. Department of Education. A series of literative design studies were done over the years to develop and improve this Foundations program until they felt they had gotten it right. Studies found that this program was successful in teaching DHH preschoolers when looking at 3 targeted main pieces of phonological awareness: segmenting spoken words into syllables, recognizing words that rhyme, and isolating the beginning phonemes in words. Overall, the study was proven to fill in the lack of phonological awareness these children had. The best part? The program is affordable. So far, you should notice that most of the research discussed helps or supports DHH students in developing English. This is a big problem with the deaf community. While it has been deemed unacceptable to discuss a woman's body or the color of skin, the idea of unwanted deafness persists, seeing it as a disadvantage. Who sees it this way but the hearing population? Individuals who are deaf don't view themselves as damaged, and they are tired of stereotypical judgments. Many of us don't even realize that we treat or view this culture below our own. When talking about these individuals as a person, we would typically refer to them as a deaf person. Yet, would you refer to your friend as a hearing person? In addition, hearing individuals are usually hired to instruct these students. But why? Over the years, there has been an increase in the procedure for cochlear implantation, even though only about 50% of these procedures lead to language acquisition. Medical professionals encourage parents to stop the use of ASL with their child, which hurts many children as these implants often don't work. These devices are known to cause pain and other side effects, yet they are encouraged as they are said to fix a medical concern. In reality, it's a social one. Research shows that exposure to sign language to a DHH student results in language development patterns that mirror that of a hearing child when exposed to spoken language. If too much time and emphasis is spent trying to get a student to achieve spoken language, valuable ASL and print time is lost, creating an achievement gap for that student. Many parents are unaware of this as medical professionals push to try and fix the issue to gain spoken language. I would like to take a moment to address appropriate assistive technologies that can help these students, as many of these advancements allow the hearing and non-hearing cultures to come together in communication and academics. A study found that assistive technologies in the classroom for hearing impaired students made them more independent learners no matter which technology was used. Parents also supported these findings. FM systems are the most common. This is where the teacher wears a small microphone that plays into the student's hearing aid. Students can also have an alerting device, like a pager, so they know when they are needed or called on. Additional technologies used tend to revolve around translating, like captions on videos, talk to text, text to talk, word prediction. Take a moment to think about the impact of the iPhone or Apple for individuals with hearing impairments. Many hearing aids can be connected to phones with Bluetooth. Also, Apple products offer all of these technology advancements that make communicating and understanding easier for students. If you ever have a student with DHH, there are many things you can do to ensure that their working environment is best for their needs. Promote acceptance of the student. Be sure the student's using his or her devices. Place the student in an appropriate seat. Increase the amount of visual information. Minimize classroom noise. Modify your teaching procedures. Have realistic expectations, and be patient with the student. When working with the parents of DHH students, it's important to remember that around 90% of these parents don't suffer from hearing loss. They may need your help learning ASL or how to best help their child. Sending them to websites like mydeafchild.org, deafchild.org, or the Center for Disease Control may help them get the resources and possible support groups that they need to be the best parent.